Thank you very much. Now, the topic today is a very new topic. Irritable bowel syndrome is it's a very difficult disease. Of course, it's a problem that we have been existing for the past umpteen years. I find that the IBS world, the people who suffer IBS, they are constantly suffering without a real solution to their problem. I've got friends who have got IBS, and my friends who went to see a doctor, and the doctor tells him, say, I think you are having IBS, after ruling out every other disease. That's how IBS is diagnosed. And then tells my friend, he says, look, there is not going to be any cure. You're gonna have probably need to suffer this as long as time goes on, and that's the state of affairs for IBS. Perhaps the solution may be as simple as a natural solution, something that is available in your kitchen. Based on the definition of irritable bowel syndrome, it's basically it's a functional bowel disorder in which abdominal pain or discomfort is associated with defecation or a change in bowel habits. So you're going to have this, I'll explain to you a little bit more. Bloating, distension, and disordered defecation are commonly associated features. Now, if you go back to the diagnosis, it's basically recurrent abdominal pain or discomfort more than one day per week. Any of this, pain related to defecation, change in frequency of stools, right? Change in form, appearance of stool. You can go to the Bristol stool chart to check and see. I'm not going to explain. I think most of you all are doctors. You all know this. For the first 3 months with symptoms onset, at least 6 months. So you wait for 6 months before diagnosis is finally made. Okay, you are having IBS. Okay, that's based on the Rome 3 definition. That's also Rome 4. Symptoms that cumulatively support the diagnosis are, I already mentioned just now, Bristol stool chart, abnormal stool frequency, form, passage of mucus. I'll explain to you probably what is causing the mucus, bloating or feeling of abdominal distension. Classical, okay, all these are very, very classical book. There are 3 subtypes. One is the one which is more with constipation, IBS with constipation, or IBS with diarrhea, or it could be mixed. Most of the time it's mixed. About 60%, 70% are mixed. Small portion, about 15% is just constipation alone, and about 15% is about diarrhea. So, but there's also another subtype, the undefined subtype, having all the issues, but no diarrhea, no constipation. So there's also another one which is undefined, and that's what I found. This is the Malaysian perspective. It affects about 10 to 20% of Malaysian population, mainly women. Some people have reported, well, there's a 1-to-1, but in some foreign, outside countries, they talk about 2-in-1. Normally, they are young women, tertiary educated. Stress could be one of the reasons. I'll explain to you in a short while. In an urban survey, this is a Malaysian survey, okay, which was done by Y.Y. Lee, reported in the World Journal of Gastroenterology 2012. In an urban, IBS was highly overlapped with GERD symptoms. Sometimes you tend to not distinguish between GERD and IBS. In a rural survey, this was done in Kelantan, right? Well, Kelantan may seem rural, but most of the patients were actually tertiary educated. So despite staying in Kelantan, but they were all tertiary educated, most of the patients, right? Majority of IBS subjects fell to mixed category with the Rome 3 criteria as follows: 20%. In the constipation group, about another 15%, 16% in the diarrhea group, and as I said just now, almost 60% are normally mixed group, means constipation and diarrhea, constipation, diarrhea. And 4.2% is unsubtype, right? Now, ages between 15 to 65, right? Now, what is the biggest issue with those patients having IBS is quality of life. Many aspects about their life is affected. Right? Many aspects of their life is affected. And I'll explain to you in a short while again. And high economic burden, because they take a lot of leave from their, so their productivity level goes down. They are not productive as individuals, although they are tertiary educated, right? And they are always having distension, pain, and they are not able to focus on their work. And this goes on for a long period of time. And this is a really a high economic burden to themselves and to the nation. You must understand this is 10 to 15, almost 20% of the population. So this huge burden to the country. Now, please don't, there is IBD, IBS, just to distinguish. Okay, there's Crohn's disease, diverticular disease, diverticulitis, and ulcerative colitis. It is different. Once you have your Crohn's disease, and I'm sure the specialists are able to distinguish with the markers that are available today to distinguish between inflammatory bowel diseases and inflammatory bowel syndrome. Okay, they are two different conditions altogether. Now, what actually causes this, we are still struggling to understand, but I think it could be genetic polymorphism. Okay, I'll go through this slide. Well, let me start right at the bottom, genetic predisposition. It could be genetic polymorphism, which could be resulting in, but normally, those days we used to say, heart disease or diabetic, 50, 60, 70, 80% is normally caused by genetics, but today that figure has come down to as low as 10%, right? 10, 15%. Genetics is not really a major cause. I suspect it is more of stress, right? Now, we all understand, and this topic of gut-brain axis or the gut-brain relationship, that's another 1 hour topic that I can talk about. But it's a fantastic, very interesting topic of how your gut controls the brain. All these neurotransmitters which is going up and down the brain. We all thought the brain was controlling the gut, but today we are beginning to realize that 80%, up to 80% of all the information is going upway this-wards rather than downway this-wards. 20% downwards, 80% upwards. Things like serotonin. And serotonin is one of the major imbalance, okay, hormone imbalance, neurotransmitter imbalance, which is causing this problem. And serotonins, up to 90% of serotonins are produced in the gut. And bacteria are involved in the gut. Microbiomes are involved in the gut to produce all these serotonins. We all thought, even psychiatrists thought that serotonin is a brain thing, right? But no, it's a gut thing, right? So it could be a gut-brain axis that is causing, and stress. I think tertiary educated people, they're going through a lot of stress probably, and this is maybe one of the cause, and I think is major cause. Okay, stress. Now, nutrition also plays a very important role in the development of IBS if you get the wrong, because you know why? There are people who change diets and IBS issues get resolved, okay? So there must be a dietary aspect of it. And there are two main people who have developed. One is the FODMAP, these fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, which seems to be giving this problem. Now, if you have come from my talk on food, nutrition, and diet, I have been talking about the reducing the 5 whites for the past 20 years. 5 whites. Okay, what are the 5 whites? White rice, white bread, or white anything made of white flour, white rice, white flour, white sugar, okay, white milk, okay, because the milk is white, and white salt. So these are 5 whites, which I tell people, if you can remove these 5 whites as much as possible, you are going to resolve a lot of issues. So white rice, white flour, white sugar, white milk, and white salt. And you will find they're all there. Lactose is one of the issues here, right? Okay, so poor nutrition. There's another lady, Dr. Natasha Campbell McBride. She's a neurologist, and in 2004, she came up with the idea that it is gut, GAPS, a gut and psychology syndrome, solution, GAPS. So you want to read about GAPS diet. So go on a low, just to give an inkling, go on a low FODMAP diet, okay, and go on a high GAPS diet. It's the imbalance of gut flora. In fact, in your hadith, it's mentioned that punca segala penyakit adalah daripada perut. Okay, it's there already in your hadith, right? Nabi must have mentioned this 1,500 years ago. So it's a gut flora that is causing a lot of problem. And today we have found that it's imbalanced. And today we have got You can do mapping, your gut mapping. You know what is happening in your gut, what are the 5-6 main bacteria formed, and if this composition changes, and this is going to cause diseases. You got the firmicutes and the bacteroidetes. These are two main ones. The ratio of this determines whether you are going to become obese, you're going to become diabetic, you're going to become heart disease patients. It all starts in the gut. It all starts in the gut. We are just focusing on cholesterol, and these are the sugar levels, glucose, and all. These are the secondary effect of the gut that is causing the problems. That's where the problem seems to be. Okay, the imbalanced gut flora. Of course, sorry. Some people also talk about the infection. There could be a transient infection. So sometimes doctors do give antibiotics to treat infection. But all this leads to increased intestinal permeability. Okay, now this is leaky gut. Now leaky gut still trying to find its way to conventional medicine. Still not there yet. But doctors don't really understand what is this leaky gut all about, right? But it is there. Intestinal permeability, increase in intestinal permeability. This then leads to immune dysfunction, mucositis, formation of mucus in your gut lining, and this is where the immune cell activation starts, the release of pro-inflammatory cytokines. This is low-grade inflammation, which is going on all the time, low-grade inflammation, and this is where the problems starts, and then this is one of the reasons why it ends up irritable bowel, and the symptoms, the classical symptoms that you will always find in patients having irritable bowel, cramps, pains, bloatedness, flatulence, rasa macam tak sedap, bloatedness, bad feeling, constipation, diarrhea, mucus in the stools, and symptoms that can last for up to 6 months before diagnosis is made. This is current treatment, okay? So if you have abdominal pain, spasms, what do? You give antispasmodic, and there are several antispasmodic that you are probably more familiar than me. Then comes the intestinal flora problem and the problem of permeability, the leaky gut flora. So what do? Right? Of course, if there is infection involved, you give antibiotics, right? But today, doctors have started giving probiotics. Now, the idea of probiotics first came in 1908 when Elie Mechnikov, the Russian scientist working at the Pasteur Institute, he got a Nobel Prize in 1908. That means his work must be earlier, okay? It's unfortunate. 100 years later, 1908 means 2008, doctors are still grasping what is this probiotic all about. 100 years later, unfortunate, when the solution was already there in 1908, it never came into the medical textbooks. Right? Now, I was looking through the data, right? The first trial done, probiotic versus IBS, is 2013. Just 7 years ago. 2013. First data coming on probiotics. Although probiotics was been available since 1908 and 1965, someone came up with the definition for probiotics. So it has taken a long period of time. Why? Flatulence. What do you give for flatulence and bloating feeling? Perhaps adsorbents like carbon. Okay, that's what you will give, or Semiticon. These are anti-gas, which probably helps to absorb the gas. These are things that you may want to give, or you're already giving. And lastly is motility disorders. What do? If it's diarrhea, you give. If it's constipation, you give laxative. If it's diarrhea, then you give antidiarrheals. So that's the state of events, the state of current treatment for IBS, right? Now, if people are having a lot bigger problems, they can't solve this, then you go second line, and second line may include things like tricyclic antidepressants or your selective serotonin reuptake inhibitors. You go psychotherapy or pain management. So this is what it is. Okay, so basically your SSRI is trying to resolve the serotonin imbalance. right? Which you can probably do it with your probiotics. Now, I would like to take this opportunity to introduce something quite interesting. I came across some work which has been done in Belgium and Italy, and I'm going to share this with you. This is a proprietary formula that includes curcumin. So I'm going to share some of this information that has come out from the Italians and the Belgians. Now, basically, curcumin, also known as diphenolmethane, is the main active component naturally derived from turmeric, kunyit. You will see that jintan manis, the active ingredient in jintan manis is called trans-anethole. It's the main active compound naturally derived from sweet. This is jintan manis, sweet fennel seed, because there's also another fennel, anise. It is commonly used to improve digestion and has potent antispasmodic and antioxidant properties. That one also got anti-inflammatory property and antioxidant. So by combining, okay, they thought ini orang Europe yang buat now. Okay, actually, all this, we should have done this trials that are done, should have been done and conducted in Malaysia, right? These are all Malaysian herbs, or rather Indian herbs, or this region herbs. Tapi kalau orang putih buat kerja, kita percaya. Kalau kita buat kerja kita sendiri, kita tak percaya. Orang putih je orang buat, baru kita percaya. This is the sad lah, stigma kita, okay? Okay, so however, these compounds, although they are all good and fine, naturally occurring curcumin and trans-anethole there, they have got a very low content, poor solubility and absorption, as well as rapid metabolism and systemic elimination. So it doesn't really, you need to find some ways to retain it, right? Now, of course, we have already now with latest in technology, I will share with you the technology that we are using, okay? Now we are using about 42 milligrams of bio-optimized curcumin, 90% standardized, and 25 milligrams. So there's a dose involved, there's a standard involved. If you're using jintan manis and all that, we do not know what is the active ingredient, the dosages which are required to have an effect, a therapeutic effect, right? Now, there are three triple actions on IBS. I'll explain to you in a short while, but just let me explain, giving you a gist of what it is all about. Reduce intestinal permeability, and I'll give you the data in a short while. It will increase IAP. I'll explain what is IAP in a short while. Decrease LPS. IAP is intestinal alkaline phosphatase activity and attenuates or reduces the release of LPS into the circulation. That's what curcumin can do. Both has got anti-inflammatory. Anti-inflammatory inhibits the nuclear factor kappa beta, decreases the production of pro-inflammatory cytokines like interleukins 1 beta, interleukins 6, interleukins 8, interleukins 12, the matrix proteinases. Okay, so that's how it works. And the last one is it has got a spasmolytic effect. Curcumin exerts myorelaxant, so it causes relaxance of the muscles in your intestinal, in your ileum and the colon area, independent of the anti-inflammatory effect. So nothing to do with that. There's got another effect there, and also the trans-anethole also has got a similar chemical effect to relax, causing spasmolytic. Okay, now just going to go a bit more deeper for you to understand what this is all about. Now, LPS. Now, supplementation with what they did was, they did a trial in rats, okay? They did a trial in rats. They gave a non-absorbable antibiotics like neomycin, okay, or polymyxin. What they did was, they fed rats Western diet. Okay, that's the Western diet. Sorry, this thing doesn't really work. Now, when you increase when you introduce Western diet, LPS is basically your bacterial endotoxins. Bacterial endotoxins called lipopolysaccharides. I'm sure here functional medicine semua orang dah faham dah. Okay, you all understand this. Now, these lipopolysaccharides are released, and if they can be translocated into your bloodstreams, then you're going to have the low-grade inflammation, which is going to go on. Okay, so LPS, it's not good. And Western diet, this is within 12 weeks, it increases LPS. They added antibiotic, it starts to reduce. With the same diet, added curcumin, it even reduced further. right? That is on LPS. Permeability. Permeability, to check for permeability, they give you a dextran, FITS, the fluoresceins isothiocyanate dextran, whereby once you take from the plasma, using the fluorescence, you will be able to detect the dextrans. So if I feed you oral, FITC dextran, if I can find it in the plasma, means it has got masuklah dalam kita punya system tu. So that means there's an increased permeability, right? So if I can reduce so with the Western diet dalam 12 minggu je, can you see the dextran is increasing, which means it is increasing your permeability. You know, in your gut you got the tight junctions. The tight junctions, okay. Now the tight junctions dah longgar, so the permeability has increased. Dextran. So once the dextrans increases, it also means LPS are also going through, right? So once they gave antibiotics, it starts to reduce because there is LPS and bacteria are being contained. But if you give curcumin, it reduces further. So permeability can be reduced, right? Now. So, curcumin restores intestinal flora, it decreases the intestinal permeability. Two possible underlying cause of irritable bowel syndrome is being addressed by curcumin. 2, right? Now, if you go on further, we also can increase the intestinal alkaline phosphatase. Now, this intestinal alkaline phosphatase is basically a gut mucosa defense factor, which is ongoing. It's natural forming in your endothelial layer of your lumen of your swan. Now, what does it do, right? Intestinal alkaline phosphatase is a brush border enzyme. So it's basically an enzyme that exerts inhibitory effect on the growth and survival of a wide spectrum of bacteria. So you see LPS there, right? Now, IAP, or the intestinal alkaline phosphatase, can stop the LPS from coming in. So it's your defense factor, right? But if you give a wrong diet, your LPS are going to go up, your IAP is going to go down, right? Just now I mentioned to you, just now you see with the Western diet, the intestinal alkaline phosphatase goes down. But you give antibiotic, it goes up. Now this is very interesting. If you give curcumin, it goes up higher than original. IAPs are going up higher than original. Original tu chow tu, you makan biasa lah, makanan biasa tu. So it's going up higher, 2 times higher than your IAP in the normal circumstances, right? This is, of course, this is all red. You can't. Now, so what happens is that in your intestinal, so that's IAP, right? Now, if you see very carefully, that's intestinal microbiome. Now, what happens is that the curcumin is able to increase IAP. It stimulates IAP production, right? And once it stimulates IAP production, it is able to stop these ATPs are being formed to promote bacterial growth. It can hinder that. It can inhibit that, and it also inhibits the translocation of your LPS going down into your blood system. Now, what is interesting is, this is an effect of a probiotic. But curcumin is not a probiotic. But what if it has a prebiotic-like effect? Perhaps that's how they are now seeing it. Because why? We know a curcumin is not a probiotic. But we know that this effect takes place when a probiotic is there, right? So we think that it is working as a prebiotic, but it's very specific prebiotic, a more selective action than most prebiotic for this issue. Right? So this is quite an interesting proposition that they have focused on, that curcumin could be a prebiotic. Now, these are the trials which has been done by Professor Dr. Piero Porticanza from University of Bari Aldo Moro Medical School in Italy. He first did this study. Curcumin and fennel essential oil improve symptoms and quality of life in patients with irritable bowel syndrome. So there are 2 issues here. Symptoms, whether can we reduce the symptoms, and can we improve the quality of life, right? So he took 60 patients on each, it's not a double-blind, but a single-blind placebo control. The first patients were given the curcumin FEO, the other one was just placebo, 2 caps twice a day. Okay, 2 caps twice a day, and and they were checking for the symptom severity score. Okay, using a questionnaire, which is quite common. I've checked with all the other papers. They also use probably the same method, and the other one is to check on the quality of life, right? So on both patients, quality of life. So they were looking at started with 121, but at the end they ended up with about less than that versus placebo. Looking at severity scores, quality of life, 2 caps twice a day, 1 month treatment, and the other treatment still carry on. Okay, so 1 month saja, dalam 1 bulan saja, right? These are the questionnaires that was given to the patients to follow up with the doctors. Now they assessed each patient every 10 days. 10 days, okay? And they were looking at the IBS symptoms severity score, and within 10 days, 20 days, 30 days, if you can see, compared to placebo, there was a greater decrease in the IBS patients who were given curcumin plus the fennel essential oil, jintan manis and kunyit, compared to the placebo, right? So there was a significant reduction in your scores, in the IBS scores. That means the higher the score, the worse it is. The smaller the scores, the lower the scores, the better it is. So it was lowering. Greater decrease. Secondly was abdominal pain. Abdominal pain. We also saw a reduction in abdominal pain versus placebo. Again, significant effect. The p-values are all there. 10 days, 20 days, 30 days. And thirdly, looking at your quality of life, every aspect of quality of life was improved in these patients. Okay, 60 patients. Looking at dysphoria, that means the opposite of dysphoria is euphoric, feeling good feeling, okay? Good feeling. So that good feeling effect was seen, this is the green one, the good feeling effect was seen in the curcumin patients. Looking at interference with activities, that means whatever they're doing on a daily basis, that is not really affected right now after 1 month treatment. Body image, very important for women, okay? Body image, it's a very strong factor for the women to feel good, to look good, and that improved. Health worries, kurang rasa, feeling better lah about their health, feeling good about it. Food avoidance. Those days they have to avoid this, avoid that, avoid this. Now less avoidance of that, food avoidance. So that has improved. Social reaction, social interaction has improved. Sexual activity has improved, and relationship has improved. This is the score of the quality of life, and they were definitely improved in those patients given curcumin and fennel essential oil. Just as a conclusion, the curcumin fennel essential oil provides early and consistent symptomatic relief in IBS patients with both subtypes, both diarrhea and constipation. And lastly, excellent safety profile. That one you cannot run away. They've given 8 grams of curcumin to patients for 3 months, hardly any toxicity effect. Unlike most drugs, normally they have got these toxicity effects. Now this is another trial. This is a trial which was done by the same group, University of Bari Medical. But this time, they asked about 70 GPs. People like yourself, okay, if you're a GP here, ask them to follow up these patients of theirs, right? So it's a questionnaire which doctors then feedback. So there were about 100 and 200 patients, and the treatment was for 2 months, right? They were given 4 caps, 2 twice a day for the first month, and after the first month, just 2 OD, two capsules, and they also check on your the severity scores and the quality of life. This is now a 2 month trial, and this results. Now before that, this was the baseline. You can see the baseline is very similar, although it's in Belgium. The baseline was very similar, about 60% IBS, 14% with diarrhea, and 24% with constipation. Now, 83% reported medium intensity abdominal pain. This is baseline, baseline. 88% of patients reported abdominal distension. 74% report a feeling of not completely empty intestine. Dia rasa macam ada still got remnant lagi kat dalam kita punya intestine, colon tu yang tak boleh keluar lagi. So dia rasa macam tu lah kan, okay, because the standard and all that kan. This is again the baseline. Patients believe that IBS had a negative impact on their life, definitely, and patients were dissatisfied with their intestinal habits. Now, after 2 months, this was the report. Right, after 2 months, there was again total IBS symptom severity scores were all reduced. These were the symptoms. Started off at 300, almost 300, 150 to 300, and you will find that they all are reducing downwards within 60 days. And this reduction was parallel. Whether you are constipation or you are diarrhea or you are mixed, they all are parallel reduction, right? So it doesn't matter which subtype you are, that's a parallel reduction of your pain severity scores. And the quality of life improved by 31% within 2 months, right? Now, which means, does it help improve abdominal pain? Yes. But if you want further help, you can give some other more antispasmodic if you want some further help. So, does it help in intestinal flora and permeability? Yes. It does. I've already shown you that it can decrease your LBS and reduce your permeability and increase your IAP. Does it help in flatulence and bloating feeling? Yes, that's also been shown. And lastly, does it help in motility disorders? Yes. And yes, right? It works for diarrhea, it works for constipation. So, today I'm putting up a proposal to all of you all. Shouldn't this be then your first line treatment? If you have got such patients, you may want to consider, because these patients are normally given 3, 4, 5 polymedicated. So maybe you might just want to start with just one course and see how they do for the next 2 to 3 months before you start to improve or monitor their conditions and see what else can you do. I believe it can also be used for IBD as well, because similar symptoms, right? What is going to prevent you from using for IBD? So this is something that you may want to consider for Crohn's disease. I've got a doctor, I have a personal doctor friend who had used it in Crohn's disease. Before he used, of course he was using Prozits then. Before that, he went to see a professor in a university, a very well-known university. They did occult stool findings, and what happened was there was a baseline. Okay, he came back, and then he was introduced the curcumin to him. He had Crohn's disease. Patient, he's a doctor. After 2 months, he went back to the professor, did the same test. That markers were all reduced, and the professor asked him, "What do you do?" And being a doctor, he says, "Look, I'm taking this product, the curcumin of ours, Prozits." And he didn't believe. I've never seen this before. The professor, in a very well-established institution in Malaysia, he didn't believe. He says, "Cannot be." Then, after that, few patients started telling, yes. So slowly, today, the professor has become our friend. We are working with him. We may want to do a trial on this, because he wants to show that does it really work. So it is very interesting. We just met him about 1 month ago. 2 months ago, right? In Melaka, right? We met him in Melaka. He was giving a talk. I was also giving a talk in another function at the under MMA. And so we met him, and he was very positive. And today he's really prescribing curcumin for his patients. So I've told him, I said, "Look, why don't you prescribe Profensin as well? Because this is even more effective for IBS, right? And even IBD, because of the presence of jintan manis, okay? Which is something found in your kitchen. Okay. Warning precaution: do not use during pregnancy and breastfeeding. I mean, this is a standard thing that we always tell people, because it's not been tested. But I don't think so it's going to cause any harm. But still, to be whiter than white, we would like to say that it's not to be used in pregnancy and breastfeeding. Do not use in bile duct obstructions. Cautions used when giving anticoagulants. I got my own views, but really the studies have shown that it doesn't really affect much. But still, I will suggest caution, and also suspend use in case of persistent diarrhea. It could be some other condition that is causing it. So you have to be very cautious. If persistent diarrhea goes on, you may want to suspend it, because some people can have an effect on this. Now, the product name, Now only I mentioned the product name. Okay, this is the Tajer kan. Okay, so that's a product of ours, Profensin. In Belgium, where the country of origin, it is called Rifensin, Rifensin. You can type Rifensin. All the data are there. We have relabeled it or rebranded it. It's Profensin because we can't use Rifensin because dia punya brand. Dosage 2 caps twice a day for 1 month. Then 2 caps once a day. Action, it acts on abdominal cramps and pains, reduces your bloatedness, flatulence, and improves your bowel movement. And this is very interesting because why it goes, where does it act on? The underlying cause. Underlying cause, intestinal permeability, intestinal flora. This could be the underlying cause, and also persistent low-grade inflammation. We know it works, right? So that's something that it can be resolved. And I think the most importantly is excellent safety profile. As I say, you can use it knowing that it's not going to give you a serious side effects, unlike most drugs do persistently. So this is something that I am proposing, and this is the technology that we are now using. Okay. Previously, we were using a different technology. This is a micellar technology, micelle technology. It's using 90% standardized curcumin that delivers bioequivalent dose of 5.7 grams equivalent. For each capsule, you're getting about 5.7 grams based on the data that they have done, combined with 25 milligrams transanethol. So basically, can you see right in the middle there, the yin and the yang, the yellow, the orange and the green part? It is enveloped by micelle, right? Emulsifier. The top head is the hydrophilic and the bottom tail is the hydrophobic. Now, curcumin and transanethol are both hydrophobic, so they can't be absorbed. But by doing this, using a micellar, you are able to improve the absorption a lot more than by using on its own. Okay, so this is the technology that we are using in Belgium, and we have brought this technology perhaps for the first time. I don't think so. There's a similar product like this anywhere in the world. So it's something very, very unique. You may want to try hydrophilic and hydrophobic tail. The micellar technology, which is it improves your solubility and bioavailability of both the ingredients. Okay, with that, I thank you very much.